The average employer has been plagued by a 125% increase in healthcare expenses over the past 10 years. During this same respective period, shareholders of the major health payers and brokerages expected returns as high as 875% and 370% respectively. A major problem is that incentives between the health systems, payers, and brokers are not aligned. Health systems don't have the profit margins to invest in new solutions without an immediate return on investment. Payers often have hidden or contractual fees and also run you through the profit cycle, where profits on your dollar fund new programs that you end up being charged additional fees for. Brokers' compensation often rises with health inflation, and they are often incentivized to add new programs through additional fees or non-transparent master contracts. So, how can we change this together? First, let's simplify the healthcare transaction between a patient and a doctor. A pretty simple process when you are healthy and see a doctor 1 or 2 times a year for a checkup and cold. However, many see numerous doctors and specialists, and each of these doctors may be at different practices, facilities, or hospital systems, and each doctor is probably ordering different lab work, scans, and prescription drugs. The reality is a majority of the time, each doctor isn't aware of your other treatments unless the patient reports it to them. This puts the burden on your members, creates wasteful spending, and lacks a health manager that can ensure optimal care. Would it not be beneficial if your members had their information consolidated under one roof? If they had a dashboard to review their own health status? If a team of experts took this data, analyzed and interpreted it, and acted as a quarterback for your team of doctors to ensure your members are receiving the most efficient form of care by making educated plan design decisions, distributing innovative health devices and technologies, implementing the most productive rewards and incentives to promote behavioral change, educating individuals with financial, social, or environmental challenges on how to access local resources, utilizing behavioral health intervention and screenings for individuals on the cusp of incurring large hospitalization or emergency room charges. I bet you're wondering how we do this. Simple. We align our interests with yours and do so with 3 key cost containment strategies. 1. Immediate hard dollar savings through advantageous contractual arrangements and performance guarantees, competitive administrative costs, best-in-class medical network execution, and transparent pharmacy contracts. 2. Use of best-in-class technology partners who have similar interests in more efficient healthcare. 3. Long-term sustainability. The technology provides the scaffolding for our team to rise to a new pinnacle with innovative plan designs, new targeted disease programs to alleviate future costs, member education and decision support, and incentives to build solution-based protocols. At a button's touch, we have a finger on the pulse of your population and can create customized, personalized health management solutions that will have proven, quantifiable impacts. This is the best part. What if I asked you to join Captivate Healthcare? What if I asked you what you are paying today? And then I asked you what your last 3 years of medical inflation have looked like. And then I said, with Captivate's solution in the upcoming plan year, you will only pay about 2% more than you are today. And here's the kicker. Not only will your rate only increase by 2% next year, we will also guarantee your future premium rate in years 2 and 3 with 2 to 3% annual inflation, which is below the CPI medical index and well below common survey results for employer medical inflation. This is the best part. What if I asked you to join Captivate Healthcare? What if I asked you what you are paying today? And then I asked you what your last 3 years of medical inflation have looked like. And then I said, with Captivate's solution in the upcoming plan year, you will only pay about 2% more than you are today. And here's the kicker. Not only will your rate only increase by 2% next year, we will also guarantee your future premium rate in years 2 and 3 with 2 to 3% annual inflation, which is below the CPI medical index and well below common survey results for employer medical inflation. Too good to be true, right? We don't think so. At Captivate, we believe in a pay-for-performance model. We believe an individual's health is the most important element of a person's own happiness and success. If you are entrusting us with your employees' well being, why shouldn't we be risking our own personal income in delivering what we promise, which is lower overall costs with a better member experience? By deploying a unified, elite team that removes excessive expenses and leverages innovative technologies, Captivate Healthcare is changing how you procure healthcare benefits, how it is delivered to your employees, and how, ultimately, together, we control the cost of care. Captivate Healthcare. Your benefit, our risk.